Hi, I'm Stephanie Morgan, the nurse manager of non-invasive cardiac studies here at Tanner Health Systems. Thank you for taking the opportunity today to learn more about managing congestive heart failure. Can we start over? I just hit the wrong button. I'm sorry. Go back and take that off. I couldn't even hit the screen to share it
Yeah, you're good.
or to change it.
We'll
Okay,
edit
start
that
that
and
over.
cut that part out, so you can just start from the top.
Okay. Well, I was hitting the wrong button, so okay, great. Okay. Hi, I'm Stephanie Morgan, the nurse manager of non-invasive cardiac studies here at Tanner Health Systems. Thank you for taking the opportunity today to learn more about managing congestive heart failure. Today, we will learn about the scope of congestive heart failure, which is CHF, the basic function of the heart, signs and symptoms, diagnosis, and treatment of CHF, as well as measures you can take to prevent congestive heart failure. Cardiovascular disease is the leading cause of death in the United States. Over 5.5 million Americans are living with CHF. By 2030, that number is expected to rise above 8 million. So, most likely you or someone in your family is affected by congestive heart failure. 1 out of 9 deaths are caused by CHF, and over 50% of patients diagnosed with CHF are dead within 5 years. So, let's dig in and learn more about prevention and care. Your heart functions by pumping blood through the heart, then throughout your body. The blood carries oxygen and nutrients via these arteries to all of your organs. The blood returns to your heart via veins where it is pumped through the heart to be reoxygenated, then begin the cycle again to the rest of your body. Your heart consists of 4 chambers, 2 atriums on the top and 2 ventricles on the bottom. These chambers fill with blood, then contract to squeeze the heart to the next chamber or system in the circulatory cycle. Ejection fraction is the amount of blood ejected from each chamber. Normal EF is 50 to 70%, not 100% because some of the blood remains in the chamber as the rest is pumped out. CHF is defined as a clinical syndrome that results from some insult to the heart, which impairs the ventricle's ability to eject blood or the chambers to fill with blood. Either the heart is not strong enough to contract and push all the blood out, or it doesn't relax enough to completely fill with enough blood. Some causes of congestive heart failure are heart attacks, high blood pressure, abnormal heart valves, lung disease, diabetes, low blood count, thyroid disease, heart arrhythmias, or drugs such as cocaine and alcohol. Congestive heart failure means the heart is not pumping as it should and causes the blood to back up into the lungs. This causes congestion in the lungs, which makes breathing harder. The heart then cannot supply the organs with sufficient oxygen or nutrients. The top 2 types of heart failure are systolic and diastolic. Systolic has a weakened EF and cannot push enough blood out of the heart to circulate the body. Diagnostic heart failure has a normal EF but cannot fill the chamber with enough blood due to the weakness. This slide shows signs and symptoms of congestive heart failure. So, shortness of breath, often when you're lying flat, weakness and fatigue, awakening with shortness of breath at night, or the need for more pillows when you're sleeping, coughing or wheezing, swelling of your feet and your legs, weight gain, or anorexia or loss of appetite. These cartoons give a visual of the signs and symptoms patients may experience with right-sided heart failure, causing the blood to pool in the body, and left-sided heart failure causes fluid to pool in the lungs. You can see these 2 cartoons, right-sided heart failure, they have peripheral venous pressure, fatigue, distended jugular veins, and also some edema or swelling in your legs. Left-sided heart failure, they may have shortness of breath, confusion, restlessness, fatigue, or their lips may become blue as well as their fingertips. This cartoon is of the patient's ability to exercise, which includes just activities of daily living. You can see class 1, class 2, class 3, and class 4. Some warning signs of congestive heart failure are increased heart rate, increased breathing, swelling in your hands or feet, weight gain, or can be caused from not taking your medications regularly. Some diagnostic tests for congestive heart failure are EKGs, blood tests, chest x rays, an echocardiogram, which shows the function of your heart, a stress test, or a heart cath. Some treatments for congestive heart failure or always education, lifestyle changes, monitoring any changes in your body, listen to your body, medications, defibrillators, or surgery such as a cardiac or heart transplant. Some lifestyle changes to improve cardiac congestive heart failure is exercise, a low salt diet, weight loss, avoid alcohol and smoking, monitor your fluid intake, and also monitoring disease such as body weight, swelling, medication, and signs and symptoms. Exercise is very important in prevention and maintaining congestive heart failure. Always start slow and build up gradually. Yes, exercise. You'll want to monitor your weight for fluid gain. Weight gain can indicate the body is retaining fluid, which can be detrimental for a person with congestive heart failure. Establish a baseline weight and a weight range, and then monitor your weight daily. The medication that saves lives are vasodilators, beta blockers, or aldosterone antagonists. Your doctor may prescribe these, or someone that you know that has congestive heart failure may be taking these. And why is heart failure so important? Because there's a higher risk for hospitalizations and mortality. It's costly and substantial opportunities to improve care and outcomes in heart failure. Some key takeaways from this presentation are to live healthy, eat healthy, be active and exercise, monitor your salt or sodium intake, and check your weight regularly. Stop smoking and listen to your body. Be aware of any symptoms and speak with your doctor about those. Take charge of your health and consult a physician if anything that you've seen today you may have experienced or know someone who has.